What causes false negative prostate cancer screening tests? Imagine going for a test thinking everything is fine, only to find out later that cancer was hiding in plain sight. That's what a false negative in prostate cancer screening means. It happens when the tests say no cancer is there, but in reality, it is. Several factors can cause this kind of misleading result. The most common screening tool is the prostate-specific antigen test. Sometimes, men with prostate cancer have PSA levels that are still within what's considered normal. For example, even if a man has aggressive cancer, his PSA might be below 4 nanograms per milliliter, or even below 2. This can happen especially in early stages or certain types of aggressive prostate cancers that don't produce a lot of PSA. Because the test relies on detecting elevated PSA, these cancers can slip through undetected. Medications also play a role. Drugs called 5-alpha reductase inhibitors, often prescribed for enlarged prostates, can lower PSA levels by about half. If a doctor doesn't adjust for this reduction, the PSA might look normal even if cancer is present. This can lead to a misdiagnosis, especially if the healthcare provider isn't aware of the medication's effect. Even when PSA levels are high enough to warrant further testing, a prostate biopsy might still miss the cancer. This is because biopsies only sample small parts of the prostate tissue. If the cancer is in an area that isn't sampled, the biopsy results can be falsely negative. Studies show that about 30 to 40% of prostate biopsies can miss existing cancer, which is why repeat biopsies are sometimes necessary. Other factors can influence PSA levels and the accuracy of screening. Obesity, for example, can dilute PSA in the blood, making levels appear lower than they actually are. Conditions like diabetes or medications such as statins and metformin may also affect PSA levels, potentially hiding the presence of cancer. Digital rectal examination is another screening method, but it has limitations. It can detect some abnormalities, but small or hidden tumors, especially those located deep in the prostate or in hard-to-reach areas, might not be felt during the exam. This means some cancers can go unnoticed even with a physical check. All these factors highlight why prostate cancer screening isn't perfect. A normal PSA or a clean digital rectal exam doesn't always mean there's no cancer. That's why doctors often use a combination of tests, imaging, and sometimes repeat biopsies to get a clearer picture. It's important for men to discuss their individual risk factors and screening options with their healthcare providers. Remember, early detection can save lives, but it requires careful and personalized evaluation to avoid missing important signs of prostate cancer. Always seek medical advice tailored to your health situation.